All right, we are going to continue the nutrition support lecture, starting with parenteral nutrition. Parenteral nutrition is also known as IV nutrition. You'll commonly hear TPN or PPN, and these are just different forms of parenteral nutrition that can be provided to our patients. What you need to remember specifically is that parenteral nutrition is reserved for patients with a non-functional gut or where tube feedings are contraindicated, but nutrition support is needed. Um, the the specific requirements or indications for parental nutrition are really important because specifically, parental nutrition is very costly, and there are risks associated with parental nutrition, specifically the high risk for infection that we don't see with tube feedings. So the two main types of parental nutrition are TPN, aka total parental nutrition, or PPN, peripheral parental nutrition. So think of TPN as us providing all of a patient's nutrition needs through a central line, a bigger vein, whereas peripheral parental nutrition is oftentimes used as supplemental parental nutrition, um, and typically is going to be providing just amino acids and carbohydrate through a smaller vein, usually in the hand or the arm. So, some challenges for parental nutrition, particularly PPN, is that they have to be delivered in such high fluid volumes to meet protein or nutrient needs in general. But also because it is so diluted in high volume, it can cause collapse of the veins. Now, just like we had different access points for tube feedings, we have different access points for parental nutrition depending on if it's a short-term need or a long-term need. Our short-term access is usually going to be in the CVC or PIC line type. And there are special nurses and healthcare providers who insert CVCs or PIC lines. The good thing about these, generally, particularly the CVC, is that they are more ideal for a TPN because they are a larger vein. The closer that you get to the heart, the larger the vein is going to be. Whereas our PPN, we're using the back of the hand. Our longer term access is going to be more of an implantable port or a tunneled catheter, similar to what they might place for a patient who's undergoing chemotherapy. Now, TPNs can be provided in a couple of different ways. And this is separate from PPNs, which is usually a Clinomix bag hanging just like this. So this is an example of like what Clinomix might be. And whenever a patient's on PPN, they're going to have just this hanging. If a person is on TPN, and we're providing amino acids, dextrose, and lipids, then we can see either this 2-in-1 solution or a 3-in-1 solution. And basically, do we have amino acids and dextrose plus lipids hanging separately, or do we have amino acids, lipids, and dextrose hanging in the same bag? And the difference here is that we can see through this bag, and that tells us that there's no lipids in here. See, this is lipids, milky, white. This has lipids in it. It's in milky white. So the advantages of the 2-in-1 is that there's more flexibility because we can get different concentrations of amino acids and dextrose. And if something were to go wrong with the contents of the bag, we would be able to see it. Disadvantages, you have two things that you have to administer. So that's more to work with, essentially. In a 3-in-1, it's incorporating all of the nutrients that are required, which makes it a little bit easier. However, we can't see if anything does go wrong in the bag. We're also going to be limited by the electrolytes and the final concentration of amino acids because they're only going to make a certain amount of these 3-in-1 mixtures. Whenever we refer to parenteral nutrition, the big difference between this and intraoral tube feedings is that the nutrients are going to be more elemental, or like you could think of it as previously digested. We're giving patients nutrients directly into the vein that are ready to be absorbed and utilized, essentially. So our protein is going to be provided in the form of amino acids. Carbohydrates are actually going to be in the form of dextrose. So amino acids are going to be provided through different solutions, which have different concentrations of amino acids. Basically, the higher the concentration, the more amino acids or protein per volume. Okay, so these are all just examples of amino acid solutions, which we saw right here. This is an amino acid solution. And one that you're going to see like in your internship, if you stay around here, is clinomics. That's what's used often. In class, we'll take a look at different concentrations of clinomics. But what I want you to notice is like if a patient has a fluid restriction, we would use a higher amino acid solution to meet their needs in a lower fluid volume. Now, as I mentioned earlier, dextrose is the form of carbohydrate that's provided through TPN or PPN. And because of this, we actually change how we calculate calories coming from carbohydrates. So dextrose, instead of 4 calories per gram, is actually providing 3.4 calories per gram. In class, we're going to play around with carbohydrate infusion rates. But what you need to know right now is that we need at least 1 milligram per kilogram per minute of dextrose infused in order to spare protein whenever we're providing parenteral nutrition to a patient. And just like our amino acids can be offered in different solutions or concentrations, dextrose can be as well. Our lipids, we can choose whether to hang lipids or not hang lipids. Our lipids are usually going to be in the form of a soybean emulsion, but we can also see olive oil and fish oil blends, which have more anti-inflammatory or immune supportive properties. Now, why would we want to provide lipids to a patient? Well, one, we know that they can help with the sufficiency of essential fatty acids. They can help us to synthesize vitamin K and, of course, provide a substantial amount of energy. Now, we might not want to provide lipids to a patient if they are seeing a very significantly impaired immune response, if they have hyperlipidemia or very high triglycerides, or are showing signs of fatty liver. Maybe their liver enzymes are really elevated. But also if a patient is on propofol. And we talked a little bit about this before, but propofol is a sedative that is infused to patients if they are on a ventilator to help keep them asleep, essentially. But the reason we consider propofol is because this is a lipid-based infusion. And so it provides lipids itself, but also the calories coming from lipids. And so if a patient's on a really significant amount of propofol, there's really no need to also hang lipids because they're already getting a substantial amount of lipids from the propofol. And then finally, we can consider the micronutrients that are contained in the parenteral nutrition solutions. This usually is going to be done by a pharmacist and critical care doctor. The dietitian definitely can have a say, especially if there are any particular micronutrient deficiencies. But for dietitians to be more competent in this area, they can get nutrition support certifications or specialty certifications for managing micronutrients with parenteral nutrition solutions. And basically, the goal for vitamins and trace elements in parenteral nutrition solutions is to provide the amounts necessary for adults. We are going to work on prescribing parenteral nutrition and utilizing this parenteral nutrition order form with case studies in class. But if you want to take a look at it, this is the general steps to writing a parenteral nutrition prescription. But as far as monitoring parenteral nutrition patients, we want to make sure, essentially, are their kidneys functioning well? Are we managing fluid and electrolyte balance? Is their blood sugar well regulated? Is their kidneys functioning? And are they tolerating lipids if those are hanging? Ultimately, the goal for these patients is to be able to feed them through the gut, whether that is initiating trickle tube feedings or trials of oral feedings. We want to really check for signs of infection because of the high risk of infection whenever we are feeding a patient intravenously. So that wraps up our parenteral nutrition and our nutrition support lectures. We will work on some class activities to get you more comfortable with these learning objectives. this semester.